Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. I am so excited to introduce to you my newly launched electrical appliance online store. It has high quality refrigerators, it has washing machines, microwaves, air fryers. It has ranges too. You can basically be cooking on top and you're baking something on the bottom. It also has these 5-in-1 food processors. Please support the work that I am doing on this platform by purchasing any of these items. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda, but in the future, as the business grows, I'll be able to ship to those outside of Uganda.
Please place your order now.
I am back to talk about the third healthcare-associated infection, that is the ventilator-associated pneumonia. Ventilator-associated pneumonia is a lung infection and it usually occurs more than 48 hours after endotracheal tube intubation or in individuals who have been on mechanical ventilation for more than 48 hours. Endotracheal tube intubation, by the way, is a medical procedure that entails placement of a tube called the endotracheal tube in the trachea, the windpipe of a patient. While mechanical ventilation is when a patient is assisted to breathe, and this is usually by the aid of a medical device called a mechanical ventilator. The mechanical ventilator takes oxygen into the patient's lungs and it removes carbon dioxide from the patient's lungs. A connection is made between the mechanical ventilator and the patient via this endotracheal tube, the tube that is inserted into the patient's trachea, the windpipe. The endotracheal tube can also prevent the airway from closing, and this helps the patient to continue breathing. Placement of the endotracheal tube into the trachea can also prevent secretions, for example, mucus, saliva, and contents of the stomach from entering into the lungs. We can also use the endotracheal tube to deliver medications during surgery, such that the patient sleeps without feeling pain during surgery. The microorganisms, the germs that are commonly implicated in the ventilator-associated pneumonia include Staphylococcus aureus, Pseudomonas aeruginosa, Klebsiella, Enterobacter species, Enterococcus species, the Enterobacteriaceae species, Group B Streptococcus, the Acinetobacter species, and in rare cases, viruses and fungi. What happens in the ventilator-associated pneumonia is that placement of the endotracheal tube into the trachea, the windpipe, switches off a given reflex, a response called the gag reflex. The gag reflex, by the way, is a protective response, and it usually causes contraction of the muscles of your throat. This prevents foreign bodies, for example, mucus, saliva, or stomach contents from entering your lungs. So it is protective in that manner. When the endotracheal tube has been placed into the trachea, the windpipe, this reflex is switched off. So the mucus, saliva, and the stomach contents can find their way into the trachea and they can get in between the endotracheal tube and the trachea, and they can seep down into the lung. That is how the patients end up with the ventilator-associated pneumonia. By the way, these secretions, for example, the mucus, the saliva, and the stomach contents also contain bacteria. So these bacteria can now cause the ventilator-associated pneumonia, especially when they overgrow in large numbers. Sometimes the mucus, the saliva, and the stomach contents that also contain the bacteria don't get directly into the lungs. But these bacteria that are within these secretions can adhere to the walls of the endotracheal tube, and they can overgrow in large numbers to form well-organized groups of bacteria called biofilms. These bacteria can now disperse, or they can dislodge from the endotracheal tube, and they can find their way into the lungs, and this can cause infection of the lungs, the ventilator-associated pneumonia. While in the lungs, the bacteria do not only cause lung infection, but they can also cause damage to the lungs, and this can result into a condition called atelectasis, that is collapse of the affected lung. There can also be empyema, that is collection of pus within the space that separates the chest wall, that is the rib cage, and the lung. The lungs can then fail to execute their duties, a condition called respiratory failure. The bacteria can also find their way into the bloodstream, and they can evoke a condition called sepsis. Sepsis is when the cells of the immune system respond to the presence of bacteria in the bloodstream by producing some chemicals called cytokines. These cytokines can cause a reduction in the blood pressure, and this can cause a condition called septic shock as a result of the presence of the bacteria in the bloodstream. Once the blood pressure has reduced, there is also a reduction in the amount of blood that goes to the vital organs of the body, for example, the brain, the kidneys, the heart, and this can result into a condition called multi-organ dysfunction. Eventually, the patient can die. For the patients that survive the ventilator-associated pneumonia, usually stay longer in the hospital, and this also predisposes them to multi-drug-resistant bacteria that is associated with prolonged hospital stay. The individuals that are commonly affected by the ventilator-associated pneumonia include individuals that have had endotracheal tube intubation, the children, the elderly, individuals that have had a tracheostomy tube insertion, individuals with a prolonged duration of mechanical ventilation, individuals that have an altered mental status, those that are unconscious. This is because they can easily aspirate the secretions, for example, mucus, saliva, and the stomach contents into their lungs. These secretions can easily get into their lungs. Individuals that have comorbidities, other chronic conditions, for example, chronic lung conditions, for example, the chronic obstructive pulmonary disease, COPD. Individuals that have had a prolonged hospital stay, as well as the male gender. The signs and symptoms of the ventilator-associated pneumonia include fever, chills, cough, shortness of breath, thick purulent mucus, chest pain, nausea, vomiting, loss of appetite. There can also be changes in the characteristics of the sputum. There can also be increased respiratory secretions, The patients out of the blue can have a lot of mucus in their airway. There can also be worsening gaseous exchange, and this is usually evidenced by a low oxygen saturation, less than 90%. These patients can also have an increased oxygen and ventilator requirement. The investigations that we carry out in the ventilator-associated pneumonia include a complete blood count, and this usually shows leukocytosis or leukopenia, that is, an increase in the white blood cell count or a reduction in the white blood cell count, respectively. We can also carry out a peripheral blood film, and this usually shows a shift to the left, that is, there will be a lot of very young white blood cells. We can also carry out a chest x-ray, and this will show new or worsening lung infiltrates. It can also show cavitations and air bronchograms. We can also carry out a culture and sensitivity of the secretions from the lower respiratory tract. The samples are usually obtained via bronchoscopy, lung biopsy, lung aspiration, a protected specimen brushing, and a transtracheal aspiration. When it comes to the diagnosis of the ventilator-associated pneumonia, we employ three parameters. We employ the clinical signs, the radiological evidence, and microbiological analysis. When it comes to the clinical signs, we look out for the signs and symptoms that I laid out earlier. When it comes to the radiological evidence, we usually look out for new or worsening lung infiltrates on the chest x-ray. And for the microbiological analysis, we usually do a culture and sensitivity of the secretions from the lower respiratory tract. And this can help us identify the bacteria that is causing the ventilator-associated pneumonia. When it comes to the treatment of the ventilator-associated pneumonia, we usually employ the antimicrobial agents. And these are usually tailored by the culture and sensitivity results. However, before the results for the culture and sensitivity come out, we can employ broad-spectrum antibiotics, especially those that cover the gram-negatives, including the Pseudomonas aeruginosa, and also those that cover the methicillin-resistant Staphylococcus aureus. And after the results for the culture and sensitivity come out, the treatment can be narrowed to target the microorganism, the germ, that has been revealed by the culture and sensitivity results. For complicated cases of ventilator-associated pneumonia, we usually treat the patients for 14 days, while those that are uncomplicated, we can always treat between 7 to 10 days. When it comes to the prevention of the ventilator-associated pneumonia, the following can be employed. The patient's head should be elevated at 30 to 45 degrees, and this can help prevent aspiration. It can help prevent the mucus, saliva, and the stomach contents getting into the patient's trachea and eventually into the patient's lungs. Regular cleaning of the patient's mouth. This can help to remove secretions from the patient's mouth, and this can prevent these secretions from getting into the patient's trachea, the windpipe, and eventually into the patient's lungs. The healthcare providers and the attendants or the relatives of the patient should also exercise good hand hygiene, and this should be done before touching the patient or touching the mechanical ventilator or the endotracheal tube. You can exercise good hand hygiene by using water and soap or an alcohol-based hand rub. And as soon as the patient is able to breathe independently, they should be weaned off the mechanical ventilator and the endotracheal tube. That is what I had for you. Thank you so much for watching and listening. Please share, like, comment and subscribe. Also hit the notification bell such that you can get notified whenever I upload a video. Please also support the work that I am doing on this platform by purchasing any of my items from my electrical appliance online store. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda at a free cost. You don't have to pay for the delivery. But in the future, I'll be able to ship to those outside of Uganda. Thank you so much, and I'll see you in my next video. Bye.